My name is Dr. Nicole DeKay. I have a doctorate in industrial organizational psychology, and I studied the impact of chronic and covert traumatic experiences in the workplace. Toxic work environments are bad for people's health. They're associated with higher levels of stress, unhealthy behavior, mental and physical health consequences, and burnout. In 2008, toxic workplaces cost organizations $16 billion in related healthcare costs, or almost $23 billion today. It's estimated that more than 120,000 deaths per year and approximately 5 to 8% of annual healthcare costs are associated with and may be attributable to how U.S. companies manage their workforce. The McKinsey Health Institute studied toxic work environments and found that they were the single largest predictor of negative employee outcomes such as burnout, depression, psychological distress, anxiety, and predicted more than 2 times the global variance of all positive practices combined. Specifically, they predicted 73% of turnover. Employees in these situations leave their jobs to prioritize their health without another source of income, which results in increased taxpayer expenses for things like TAMP, SNAP, and Medicare. These health consequences need to be addressed since they reduce worker productivity while harming the U.S. economy and social support systems. Toxic work environments also lead to negative consequences for American children. A toxic environment can leave parents feeling depleted and unable to engage in behaviors that require sustained effort like parenting. Parents with high levels of burnout tend to spend more time being sedentary when they return home, rather than spending time on activity with their kids. These environments can cause parents to be violent or neglectful towards their children, even when these parents are philosophically opposed to those behaviors. These work-induced adverse childhood experiences, which are the single largest unaddressed public health threat facing our nation today, are associated with chronic health problems, mental illness, and substance abuse later in life. For California alone, ACEs cost $112.5 billion a year. It's clear that toxic environments impact employees, children, and there's a fiscal and social responsibility to reduce that harm in American workplaces.